Do you know how powerful it is to say to a family, a prospective resident, look, our employee injury rate is less than half of the industry. We provide phenomenal care for our people so they can provide phenomenal care for you. It's extremely powerful.
Tips from Trestle is brought to you by eMenu Choice Point of Sale, Wiseox AI, and Benny Keith Food Service. Welcome to Tips from Trestle, the Senior Living Food and Hospitality Podcast. This podcast explores the senior living industry with a unique focus on food, hospitality, and the community experience. I'm your host, Aaron Fish. My goal for this podcast: educate, inform, and inspire leaders in senior living. How? By bringing the resident and customer experience to the front of mind in our industry. We should bring the passionate spirit of food and hospitality to everything that we do and everyone we serve each and every day. So what are we waiting for? Let's get to it. Today on Tips from Trestle, I'm joined by Steve Groth. Steve is a seasoned risk management and commercial insurance professional with over 20 years of experience advising business owners and executives. Currently serving as a risk and insurance consultant at Insurica, Steve specializes in proactively identifying and mitigating risk to enhance client profitability and operational efficiency. His extensive background includes roles as a senior underwriter, regional manager, and risk control consultant, complemented by professional designations as a certified safety professional and associate in risk management. Passionate about protecting people and businesses, Steve is committed to helping organizations understand the broader impacts of risk beyond insurance. Steve, thanks for joining me today on Tips from Trestle.
Thanks, Aaron.
So we are here at the Assisted Living Association of Alabama conference. You've got a presentation later today, and it really caught my eye because you're really getting tactical, I think, with kind of how you're helping operators understand risk and how it impacts their employment and retention. But I'd love for you to kind of maybe give us a broader overview, maybe introduce us to what it looks like, the problem of employee injuries in assisted living, and why you are passionate about helping solve that problem.
Sure. I'll start by asking you a question. If you were to think of three industries, assisted living, construction, and manufacturing, and if we were to consider lost time injuries, meaning an injury on the job that's so severe that it requires them to miss time, if you were to look at the injury rate in those three industries, how would you rank them from highest to lowest?
Well, my initial reaction is assisted living is probably not at the top of the list, but because you asked me that question, I'm guessing it probably is. I would go straight to like construction or manufacturing because you think big machinery,
Sure.
They're doing a lot of crazy manual labor, but I don't think we think about it like that in assisted living.
Yeah, and those industries sadly have a relatively much higher fatal injury rate. But when it comes to the lost time injury rate, and this is published every year by the Bureau of Labor Statistics, assisted living is actually 3 times construction and manufacturing.
Wow. 3 times.
3 times.
That's a heck of a number.
Yeah, and one of the reasons why I'm passionate about it is because, first of all, protecting employees is just doing the right thing. But second, it aligns with so many key business drivers. One of the barriers that I've had to work to overcome a lot in my career is when a lot of operators and owners hear employee injuries, the first thought that comes to mind is workers' compensation insurance.
Right.
And my response is, let's push that down our priority list. Let's talk about things that really impact the business. Look at it this way. In the last year, I've had 2 family members who moved into assisted living. And when I talked to my 2 aunts, I talked to my parents, had independent conversations with both, and just asked about the thought process and how they chose the community they eventually chose, they all said the same thing. They said the people.
That
They walked in, and it reminded me of a conversation I had with a marketer about 10 years ago. She said, our staff is our best sales force. If we get somebody on a tour, they're sold.
Yeah.
And my family, when asking about the communities they chose, it's no knock on food or supporting operations or physical building itself, the amenities, it's no knock on any of that. But they just talked about how warm, happy, welcoming people were.
Yeah.
How can you be warm, happy, and welcoming with chronic back or knee pain?
Yeah.
Like really, how can you?
Yeah. I can't imagine.
And in my career, I've probably been in and out of 600 long-term care communities, SNFs, ALs, CCRCs, memory care, everything. When I started my career and I was doing safety and health consulting, I knew right when I walked in the community that had a good safety program versus the one that didn't. Yeah. Because you saw the way that people walk.
Yeah.
Walking like back pain versus those who almost had like a skip in their step. They were happy to be there.
Yeah. No, and it's not something that I think operators think a lot about, like you said, right? Of the ongoing chronic pain or what, because we don't always think about like it can be a very physical and demanding job, providing care or working in a kitchen and being on your feet for 8-10 hours a day, even something that seems innocuous like activities. The activity director is up and down and moving and doing a lot of that. And so when you thinking about your background, right, with risk management and being in insurance, how have you seen employee injuries impact like staffing and turnover rates with the people you've worked with?
Absolutely. When I talk about the key drivers, I think about 4 that I would put before insurance. And you just touched on one: staffing. I mentioned occupancy, quality of care, and also culture. I believe those 4 drivers are a much higher priority than insurance. So you asked about staffing. In my career, I've done a lot of work in small towns. And one time I had 2 clients, both communities in a small town, and they were in a constant labor fight, constant. And and I'm just going to refer to them. They were assisted living, so they're not on the 1 to 5 star system, but I'm going to refer to them as 1 star and 5 star.
Really? Okay.
I mean, It was a blessing for me because I had this incredible perspective. I would always visit them in the same day. I'd visit one in the morning, one in the afternoon. One was extremely well written.
Yeah.
And let's just say the other had some work to do.
Yeah.
And that impacted everything, including safety of their staff. So I was visiting the 5 star ones, and they were concerned. They said our crosstown rivals are about to raise pay and we are not in a position to match. And they said, we're concerned we're going to lose a lot of our best caregivers. And they did. Next time I was there, the lady who did all of their employee training, I walked in, I still remember she kind of came running up to see me. She said, I heard you were going to be here. I said, okay, what's going on? She said, we lost a bunch of our best people and they almost all came back. I said, really? Like, were you able to match the pay or what happened? She said, no, we couldn't match the pay. Human Resources asked every employee that came back. They said, we are so happy you're back. What made you decide to return? She said that they heard a lot of responses. The number 1 response was, over there, they don't care about our safety. Here, we know you do.
Yeah. It leads me to want to talk to you about the second thing, that culture. You'd mentioned that, and I think that kind of illustrates it perfectly. How can workplace injuries influence company culture? And from your perspective, what kinds of things do you recommend, or would like that 5 star community, would they do to really kind of cultivate safety as a part of their strong culture?
Yeah, actually, here, and I've got a little prop for us here.
Yeah.
Step 1, hold it up for your camera. And if anybody's interested in this tool, it's just a basic self-evaluation. Step 1 is I recommend every community, every organization, every region to know your data. That's step 1. Do an annual analysis at least and understand your employee injuries. I would look at your lost time injuries. By the way, you already have to record it annually at the community level for OSHA. You have to do this. So you're capturing the data. Let's make sure we use it. And so I would look at lost time injuries, and then I would also look at what I call labor disrupting injuries, which is they didn't lose time, but they had to be transferred to a different department. They could only do 80% of the job. We had to closely monitor them to make sure they didn't re-injure themselves. So that's step 1. And step 2, and I think this is where it ties into culture as well. As you're doing that analysis, identify how many of those injuries involve what I would call the rock stars.
Yeah.
The caregiver who doesn't get paid enough for what they do.
Right.
All the intangible value they bring, that they're a pleasure to work with. They're an informal trainer and mentor. They bring so much value. What if we lose one of them for 6 weeks? What is the impact of our operations then? What about just the impact on our culture? Because while they're not an official leader, they are a leader. Like, for example, my cousin's a CNA. She's the type of person that every one of your listeners would hire if they could. She talks about her residents like their family, and she talks about her prior very serious work-related injuries, both requiring surgery. She talks about them like they're battle wounds. Like, this is just what happens This is just part of caring for the people you love. And to lose somebody like her to a major medical incident and surgery and a lot of recovery, I'm sure they were overjoyed when she came back, but what were they missing when she was gone?
Yeah.
And so step one is to really capture the data. Step two, an entire safety program is theoretical, except for the response to the incident itself. When I was in a leadership role, I was working with one of my consultants. She had a client that had like 18 locations across multiple states. And they did an annual executive level risk management meeting. By the way, this is a topic that needs to be handled first at the executive level.
Yeah.
You need to lead from the top. And the meeting was run by the CEO. And what they would do is they would revise their risk management plan for the year. And part of that is they would look at prior injuries. And their director of human resources was going through the investigations of their large injuries, the ones that were like over $50,000 for workers' comp. The CEO said, I want to know what happened, what we learned, and what we did about it. And it got a little bit tense in the room because she was reading through these and every single response was to blame the employee. And my consultant, she was in this meeting every year for 10 years. They respected her immensely. And she could say things I certainly couldn't say in this room. She said, may I ask a question? They said, absolutely.
Technology continues to drive changes in senior care, and that includes food service. eMenu Choice is an award-winning point-of-service application for managing the dining function in senior living communities. This mobile, touchscreen-enabled software enhances the dining experience for residents while streamlining processes for staff. The flexibility and functionality of eMenu Choice makes it an effective solution for any type of senior living environment, from independent and assisted living to skilled nursing facilities. It works for production kitchens or restaurant-style service with options for per meal or a la carte pricing and accommodates a variety of payments, including bill to account, meal credits, and credit cards. Created by a senior care provider with more than a century of experience serving older adults, eMenu Choice eliminates communication barriers between staff and residents while enabling person-centered choices and greater resident satisfaction. eMenu Choice, transforming dining for senior living.
She said, are you hiring them stupid or are you training them that way?
That's a really, really good question.
Everybody laughed except for the CEO. And the CEO said, message received. She said, she looked at her team and she said, this is unacceptable. She said, some of our valuable people were seriously injured. They missed time. It impacted our quality of care. Other caregivers had to pick up the slack. We may have needed to hire new people. We may have needed to go the agency route. This was costly to us. And we have no answers that we as leaders learned and could have done differently. So if anyone would start out and say, what do we do to really impact this, is know your data and take a close look at your response to incidents. I'm not saying the rest of the safety program, your training, your quality assurance, I'm not saying it doesn't matter. What I'm saying is that's actually theoretical. Incident investigation is now a life has been impacted.
Yeah.
Residents have been impacted. Families at home have also been impacted.
Yeah. And it makes me want to dive into the resident part of this a little bit, right? We've been talking about the impact on the culture and the employees, but there's a definite impact on the residents, right?
Absolutely.
And so when you see a situation like that, where there's a lot of lost time or something, where do those employee injuries come in and influence things like occupancy rate and kind of the profitability of the business? Kind of think maybe taking away the actual dollars and cents of, okay, a $50,000 work injury or whatever. How do you frame that?
Well, I would frame it this way. Again, everybody should start out doing their own assessment. That's step one. And a lot of folks who do this, obviously, if they take a look at the industry average, which is publicly available, and they say, hey, we're 50% of the industry average. Guess what that means? That means marketing materials. Do you know how powerful it is to say to a family, a prospective family, resident, look, our employee injury rate is less than half of the industry. We provide phenomenal care for our people so they can provide phenomenal care for you. It's extremely powerful. My best operating client, I mean, their turnover is almost nothing. They were the first client that I did this with. Their employee injuries, we look back 3 years, they're at 25% of the industry. And what a great story to tell.
Yeah.
And so obviously those who are above the industry, you don't want to tell that story,
Right.
but it should light a fire to really work to improve this. Because if I were, and again, I've had family members move into assisted living, it would be impactful to me to know that these people practice what they preach with everybody under their
Yeah.
care, which includes their team members.
Yeah. I think that's such a good message too, right? For residents to hear that we're going to take care of the people taking care of you.
Correct.
So that's just one more feather in the cap of like, obviously you're paying attention to the details and
Absolutely.
therefore I know I can be taken well care of. When we first kind of talked about the getting together on the podcast, one of the things that was part of your presentation is that the workers' comp piece it's there and it's important. You need to have it, but
Yep.
that's not really where the value comes from all of the things you're talking about. What would you tell to the listeners or other business leaders? What are some of the misconceptions that they may have about some of these broader impacts that we've been talking about beyond those, like I said, dollar and cents insurance
Sure.
costs?
I think one of the misconceptions, and I'm not going to throw my friend under the bus. I have a friend he's in IL right now, but he spent a lot of his career in assisted living and memory care. I've dealt in my career with a lot of people who are a personality like him, who like to be a little bit of a devil's advocate, saying, well, there's nothing we can do about it. It just is what it is.
Yeah.
You know, and I've been in far too many communities who have next to no injuries to believe that.
Yeah.
I've seen the work that they do. Like I've got a great example. I was working with a client and he said, he's the owner. He said, look, my wife handles everything with our safe resident handling and mobility program. She's a nurse. And this is just a small family owned and operated community. It's not a large corporate operator. I was on the phone with her for 45 minutes as she was telling me everything that they do from
Yeah.
a safety standpoint. For example, she personally does a top to bottom annual analysis of every piece of employee training every year.
Oh, wow.
And
Yeah.
she engages every resource she knows to say, is this still current? Do we need to improve this? She says she makes changes every single year. She has an extremely in-depth quality assurance process that we train people, but then we also have a process of doing our honest observations to make sure that they're actually following through on what we've trained them. And then if there are things that they're doing incorrectly, areas for coaching opportunity, we train our leaders to intervene and have conversations with them. And by the way, those conversations are not, hey, we could have a workers' comp injury. That doesn't motivate people, but it's a good leadership conversation. When I was in a leadership role for 4 years, what I learned right away was probably the best lesson in leadership was the best way to motivate employees is to show them that you care about them for 24 hours and not 8.
Yeah.
And employee injuries impact employees for 24 hours. It impacts their kids. It impacts their hobbies. It impacts, we're in Gulf Shores. What if somebody has a trip planned for Gulf Shores and they have to cancel it?
You miss out on the beach and everything.
Exactly. So a good quality assurance program, the leader will intervene and say, hey, I noticed you were standing in this position while you were doing the gate belt transfer. If you do that, it could lead to this type of injury. And I know you have a 2-year-old and a 4-year-old. What kind of things would you not be able to do with them if you hurt your back?
Yeah.
That motivates people. That's phenomenal leadership. That impacts culture in a positive way.
Yeah. I love the way you frame this idea of the 24 hours, because as you were talking, I was sitting here thinking about the different trainings that I had done in the past. And I immediately came to the simple task of lifting a tray of dirty dishes off of a tray jack. And that was something that, I mean, we did role plays when we did the training. And I think initially people were like, this seems really redundant. Why are you teaching us this? But the value of being able to say, well, because if you pick it up wrong, you'll hurt your back. And then you're not working for me, but you're also not doing all those other things that you want to do. Being able to share that story and that message with them has a huge impact.
Exactly. I mean, think about how much time we spend in this industry assisting people with ADL.
Yeah.
And then you have an employee hurt on the job. Now they need help with ADLs. I had a bad shoulder injury skiing about 8 years ago. And anyway, after I had surgery on it, it was my left shoulder. I realized I couldn't close a car door. You sit in the car and you grab with your left arm. I'm on the phone with my dad. He's a golfer. He said, why don't you just put your pitching wedge in the shotgun and you can reach over and hook it. But anyway, anybody who's had surgery in their life knows that there are basic tasks that you now need to modify in some way or get help with.
Yeah.
And I had a client, I was sharing this story with them, and they incorporated this into their training. They literally went out into the parking lot And they said, we need a volunteer. We said, okay. They'd open a car, they'd sit in it, and they'd say, you can't use your left arm, shut the door. And everybody laughed. But they started the whole topic of start with why. They started their safety training, because how many safety trainings have people been through in their life? It's like, oh my,
Oh yeah.
why am I being punished?
I just pop the video, the road. Yeah.
Sign this sheet. Okay,
Exactly.
now I know what matters. No, well, but no, if you talk about people's lives outside of work, if you talk about the residents that they care for, the reason why they're in this business at all, you're not going to be able to provide care for residents. You know, when you're on an airplane, they tell you to put on your mask first so you can help others.
Yeah.
So those employees, your best employees, how are you going to help others if you're not helping yourself?
Yeah.
And how are you going to help your family at home if you're not helping yourself? So this is the way we need to look at it. We just need to broaden our thinking. And again, I'm not minimizing insurance, but if we think about these things, I'm telling you, as a commercial insurance broker, the more we start with risk, we start with culture, we start with really good best practices that we're implementing, the insurance just takes care of itself.
Yeah. And that's a great way to kind of wrap this all up. So thank you for sharing all of that, Steve. Let our listeners know how they can contact you, learn more about the work you do with Insurica, and how they can learn more about risk versus insurance.
Absolutely. Well, yeah, if anybody wants to get in touch with me, I'd say just connect with me on LinkedIn, Steve Groth. I would encourage you to reach out to Aaron. If you'd like to know really step one, I'm telling you, everybody can do their own self-assessment. This goes through your data. It also goes through a little bit of a personal self-assessment. Like, I encourage people to consider the personal impact of a work-related injury on them. It makes you better connect with your employees. So honestly, step one, I would say reach out to Aaron. I'm going to give him this tool. You can reach out to me. My email address is steve.groth@insurica.com. I would say step one, do your own assessment. Get a feel for how your organization is currently looking at this. Look at where your numbers stack up. And then we can have a conversation about things that we can do to take you to the next level.
Well, Steve, thank you for breaking away from the conference. I'm looking forward to your presentation here shortly. And thanks for being a guest on Tips from Trestle.
Thanks, Aaron. Appreciate it.
So there it is, everybody. Another one in the books. Thanks again for tuning in. Please follow, like, and subscribe on YouTube, Spotify, Apple, or wherever you get your podcasts. And be sure to follow us on social media at Tips from Trestle. You can also learn more about the work I do by following me on LinkedIn, Twitter, Instagram, and even TikTok. And be sure to check out Trestle Hospitality Concepts at www.trestlehospitalityconcepts.com. I'm your host, Aaron Fish, and this has been another episode of Tips from Trestle.